Okay, let us admit more into the meeting. Okay, just a couple of minutes and we will start. Okay, so this webinar will be about showing case a couple of exams that the Royal College of Surgeons of Edinburgh and also the other Royal Colleges are providing now for pediatric dentistry, and up to next April, in which the MP Dent or the membership exam will still have the same name. And it will also change starting from fall or September 2026. It will become the Fellowship of Pediatric Dentistry as well. So that's what we refer to as MP Dent exam, which is currently the membership. And from September 2026, it will be the Fellowship exam. Also, recently in the last year, they have introduced the Diploma of Pediatric Dentistry exam, which is different from Diploma of Pediatric Dentistry for dental therapists who work in the UK. So it's a different one, and it's directed for dentists as well. And we will talk about that in the second part of the webinar. About the membership exam and its features and advantages. First, it opens your chances with more acknowledgement in some Gulf countries like United Arab Emirates, Oman, Saudi Arabia, and Qatar as well. And we know that recently Saudi Arabia has introduced more changes in its system to recognize the membership exams from the Royal College. We know that they were having some problems with that, but it has been confirmed from more than one candidate who is living there in Saudi Arabia that they have upgraded their specialty agreements with the Saudi board using their membership exams as well. The other thing, it takes you to the next level in the knowledge and handling complex cases. After getting familiar with the material and getting, maybe you are already in a training that is accepted by the Royal College, or you have completed a training in some country that is already acceptable to the Royal Colleges, and you want that extra knowledge that they have there for specialists, for multidisciplinary planning. So it makes you more competent in dealing with these difficult cases that you might have been faced like with a wall or a barrier before. So it's really a very good update for the knowledge. Also, it opens up opportunities for training and teaching as well, because it's something that the Royal College want to expand the exams, and more people like from Middle East, from India, wants also to be included in these exams as well. And it's like there's a lot of exams all around the world. Now we hear about the IAPD fellowship and some other board exams, and even in like the declendent exams in the UK. But all the candidates, when we meet them over there, they say that this is like the most intense exam, and also the one with the most benefit. Like it really shows that you have knowledge. Okay, about the prerequisites of this exam, you should have acceptable 3 years full training program to be assessed by the specialty board. This is important. And for this one, like a lot of people from Egypt will ask, so I have master's degree and it was already 3 years training, so why they are not accepting me? The problem with the master's degree here in Egypt, it's first, the clinical time, it was not every day. They need that you go to the clinic every day in your university. The second part is that the curriculum is different from the UK curriculum. But in India, as we compare in India, the curriculum is really similar, and they were attending each and every day. In India, the master's program is like 6 days a week. They go to university 6 days a week, like 5.5 days. So it really covers the clinical part, and the curriculum is similar. And they also had these evaluations, the practical evaluations that's a little bit similar to the UK system. That's why they are getting their applications are getting accepted more and not getting like a lot of rejections like the Egyptian master's degree. They also require that this full-time training is at least 60% clinical, 25% didactic or lectures, and 15% research. And what actually, like, they write that, but the most concern is that 60% clinical or more, at least 60% clinical. That's what they are looking for. So if it's like you are going there 5 days a week and there are 10 sessions like AM and PM, you should like have 6 clinical sessions at least per week to have this 60%. Curriculum similar to the UK curriculum, which is available on GDC website, so it should be a little bit matching. They also, the UK curriculum have the part of communication skills, how to talk to the parents, how to deal in this, how to deal with confidentiality. But when the Royal College like analyze your program, it looks at the pediatric dentistry parts, the communication part, like they don't insist on that when they are like evaluating your curriculum as well. And completing all the paperwork. It's currently like they require a lot of things, like 8 points in the paperwork, but they say that afterwards, like starting from September, the whole paperwork dilemma will be less, like they require papers, but less than the current requirements. Okay, so what about this exam? So what's all about? It's 4 days. They are divided into different parts. Day 1 is the MCQ part. This MCQ part is 180 questions, single best answer, but it's divided on 2 papers, 90 questions and 90 questions. And they will test you in your knowledge, like in the numbers, the statistics, the UK system, something like not all clinical, some managerial points about the UK system as well. So it needs like previous exams and to be familiar with their MCQ questions as well. The second day is the OSCE cases, which is a communication exam, 6 cases. 3 minutes of preparation and 10 minutes of communication with the parent of the child. Like now you are meeting with the parent of the child, you have this, he has some concerns, you need to address the concerns, you need to explain the treatment plan for them. So they test you on that. And this is also, we have this in pediatric dentistry in next April. And then afterwards, they will tell us the updates. Day 3 and day 4 will be unseen cases, normal viva exam, long case, questions, 15 minutes of questions, 2 examiners, like 2 top-level examiners who are testing you on your treatment planning and your knowledge about the case. So this is also like a strong part of the exam. Okay, so for the written paper, like we said, 2 hours, single best answers, covering pediatric dentistry, all the points in the blueprint. Because all the exams that they have, they provide you with the blueprints that you can follow and assess your training as you go and the parts that you need to cover as well. Each question is 1 mark, and they will not like give you a penalty or give you a minus if you choose the incorrect answer. The pass mark for the MCQ is predetermined by a standard process, which is different in each diet. Like one time you will find it 114 out of 180. Sometimes you'll find it 110 out of 180. Like they have a curve, and they determine the success mark accordingly. Okay, for this is like for the written part of the MCQ part. For the OSCE stations, it's based on clinical scenarios to assess your communication and interpersonal skills. This part, it should be like different clinical situation. One will be explaining treatment planning, one will be parent who is refusing everything, one parent will be complaining from something in the clinic or in the department. So it's different, and this part needs special training. In the OSCE stations, it needs special training because something different that we have here in the Middle East or India. So you need to have special training for that as well. So as we said, 6 stations, 3 minutes of preparation, which is not too much. Sometimes they'll give you like a long paper and you need to read it really fast. You need to know what are you going to discuss and be confident while discussing that with the parent as well. Total exam time is like 72 minutes because it's 6 stations and 1 station of rest. They give you a rest, and the rest, like it's not 3, then 1 rest, then 3. Sometimes the rest will be your first stations. Like it's different. So far, each station will be 25, and they are 6, so it's 150. And the pass mark is 90. It has been 90 for a long time now, but they are testing your personal and communication skills. So this part needs special training and needs a lot of practice as well. There are 5 domains in which they are making their evaluations. They see how you listen, how you summarize, how you signpost, how you empathize. This is all important in this exam. For the unseen cases, you will get 10 minutes to prepare before each case, and you will have 15 minutes with a couple of examiners. The examiners will change at each cases, but sometimes you will meet examiner, and then tomorrow in the other 4 cases, you will meet the examiner again. So total, you have 1 hour and 20 minutes of preparation and 2 hours of examinations as well. About the notes, you will get a booklet of the case, and you can until like recently, the previous diet, you are taking this booklet with you inside the room and discussing that. So in that booklet, you can make notes, you can make lines, and you can take it and like refer to it while doing this exam inside the exam room. Before, you were not allowed to take this booklet with you. You were only writing on paper. Then you find a whole other booklet inside the exam room, and then like you only have your summary, which takes time. But having the booklet saves you time by only making annotations and making lines on the booklet and taking it with you inside the exam room. This is only for unseen cases, but for the OSCE, no. The case will be on the wall before you enter, and then you enter the examination booth, and you'll find another one on the table. Okay, so and once you exit the exam room, they will take the notes from you. Okay, so about the MP journey, first, the exam will open in the website. You send your paperwork and wait for the approval, which takes time. Afterwards, after you get your approval and pay for the exam, you get your visa letter and make the visa, because all the exams now are still in Edinburgh, or the pediatric dentistry exam. And then you go ahead and take your exam. So what's the preparation left? Passport, CV, previous certificates, the training program description in PDF from your training institute, and curriculum, also curriculum and learning outcomes and teaching methods if you have it. The weekly timetable is important for each semester. Like if you have it, it's okay. If you know it or remember it, you write it. You want to know like how your week was going in your training. The letter of support from the program director or your senior, just saying that you have been training in that period and you have successfully completed your training, and that he recommends you for such exam. A lookbook with the ID of the patient and the procedure done and any comments. This is important. You need also to include like what you have of GA cases or sedation cases in a summary, and also get it signed by university. All sorts of evaluations that you have taken over there, any clinical evaluations, seminars evaluations, case-based discussions, exam results. They are all important in supporting your application. And clinical audits or clinical governance. Now they require it from each and every candidates. They want a clinical governance project, so you do this. And in the course, you will have some sort of explanation and examples, so you can carry on a clinical audit. It's not very difficult, but it also needs for you to invest some time and do it as well. And of course, applying for the UK visa. After you submit the papers, the evaluation board will get back to you. Maybe sometimes it will take 6 weeks or even 8 weeks. The study materials, there are textbooks, guidelines, notes, previous exam papers, and of course, mock exam and training. So after you get the papers and the material to study from, you need to do a lot of exams as well. And you need to do a lot of training so you can know what's all about and get sense of what you are facing in this exam. Okay, so once you are preparing for the exam, you should do an exam-based studying. You are going there for MCQ, for OSCE, and unseen cases. So it's not about like reading the papers over and over again. It's about training for the exam itself. So for the MCQ in the course that we provide from Wident and Roy Dreams Academy, there will be an MCQ bank, a large MCQ bank with all the previous, a lot of previous questions, which makes you familiar with this kind of exam. Sometimes 2 or more answers will be correct, and you choose the best correct answers. For the OSCE, because it needs special training, first you will get fundamentals about the OSCE, like why they do OSCE exams, why they want to test your communication, what are the domains of the OSCE exam, how can they give you marks for OSCE exam. Then you will get training on cases. But first, you need to set up the fundamentals, the basics, the language. This needs to be also like really good with you. It depends like with a good percentage on your command of English and your communication skills, but it also needs this training so you are familiar with this part, because it's like it's special for UK exams. You'll not go somewhere and they will test you for communication, except for countries who are applying the UK system. So this part is special for UK. And sometimes they will test your communication skills in the OSCE. Sometimes they will still test it in Viva exam. Like they can tell you, well, if you have a single mom, what kind of support you can give to her in a Viva exam. Like you are going there to be asked Viva questions in your specialty, but they want to know how are you empathetic? Are you safe to deal with moms and children in the UK? So always remember in this part that they want a practitioner who is who can work with in the NHS system in the UK, and they will not cause problems. Like you as a dentist over there will not cause to them like a lot of problems. So they want to be sure of that. The unseen cases, so it's full curriculum study and also include case discussions. There will be case discussions also along the course and at the end as well. Okay, so for our course, it will be covering the whole curriculum from exam point of view. Like we'll explain the chapters along the curriculum, and while explaining the chapters, we will tell you, well, this appeared in the exam in that way, and this one appeared in the exam in that way. So you can link what you're studying to the exam, and there will be structured OSCE course to lead you to the best possible performance in this part. What's from your part is to have a good command of English. And from our part, we will tell you about the theory behind the OSCE, how to increase your level in the OSCE, what kind of training you can do in the OSCE, and train with you in OSCE. But from your part, you need to have communication skills and good command of English as well. We'll be providing handouts, like we will not give books and papers for you to summarize. You will get everything summarized. We have acquired this material when we traveled to the UK, and we have seen them studying that. Like in King's College, candidates are studying from the same material we will give to you. And University of Edinburgh, they are studying from the same material that we will give to you. So it's a really concise material. It have everything summarized, all the papers, all the policy documents, which are really boring to summarize, but now we have it summarized and up to date. So like this is really important part. You will not get like a whole sea of papers to study from. You will get only one source, which have all the sources inside, and it's summarized as well with good tables. So you can go ahead with your readings. It's not a small document, it's a large document, but it have everything inside it. So you don't need to like go and search a lot and do that. So this is really beneficial as well. There will be like a half mock exam, because the real exam have 6 stations of OSCE and eight stations of Viva cases. In our course, you will at the end you will get 3. Like along the course will be case discussions as well, but in the end you will get one-on-one 3 OSCE stations one-on-one and 4 unseen cases one-on-one as well. Okay, so the cost of the exam and the cost of the course. Okay, so the current MP Dent exam is 180 UK pounds per sitting. And also after you do this exam, there is like a little bit fee, like 100 to 200 pounds for the election, and they can give you the title, which is membership or fellowship in pediatric dentistry. And there is visa fees and travel fees. So for this part, you are looking at like $3,500 US, maybe up to 4,000, like somewhere between that. And this was according to our exam, which was like 2 years ago. Like the accommodation fees and the traveling fees and everything will be around that. The cost of the course, our course is about 18 lectures. And for this course, before we go to the exam, we were attending courses and with UK dentists and other dentists. So what they were doing, that they will give us like 10 sessions for 1,000 UK pounds, or 20 sessions for 2,000 UK pounds. And sometimes it will be like less than these sessions for the same number. And because we know that we are like dealing with Egyptian dentists and also Indian dentists, so our current course is around 1,300 US dollars, and you can like pay it in one go. This can be paid in one go, or you can pay a reservation fee of 650, and then before starting the course, you pay the other 650 as well. And we are planning to start the final revision for MP Dent on the mid of October, like next October, in the middle of it. So how to register? We will paste a link on the WhatsApp group, so you can register and also choose your preferred method of treatment. And you can fill the form if you are interested in the course, and we will be happy to assist you throughout the process. So this part is for the current cost of the course as well, and how to register for it. There is also this course, like this is a whole comprehensive course in which you will get the chapters, the explanation of the chapters, OSCE training, and alternatively you get one OSCE case and one case discussion, like each and every session. This is suitable for people who have time to attend the exam. But what if your exam is in the next month or the next couple of months, and you don't want new materials, you don't want big documents, you just want exam training? For the exam training, like only mock exams, like OSCE stations and Viva cases, there is also, like with the single session, you can book a single session for 150 USD, or you can book like a whole of 10 sessions at the price of 1,000 as well. So there are two types of the course. The first one, which was like comprehensive, about 18 lectures, and the other one is only mock exams, in which you just get a test. You are being tested for the exam, like the real exam, and you get a feedback on what your strength point and what's your weak point as well. So these are the two types that we are providing right now for that. Okay. So okay, so let me test that. Am I still audible?
Yes, very much.
Okay, very good. Because we are trying to, in the meeting, it has freezed on one of the. Okay, so let me stop presenting and then presenting again. Okay, so that's the first part for this webinar. It's about the final revision for the membership exam, the tricollegiate membership in pediatric dentistry. And it's for people who are already in training, which is accepted to the Royal College, people who have completed training in which they know that it is accepted for the Royal College, because they analyze each and every application separately, and then they give a decision on that. And the second part of this webinar will be about the diploma, the new diploma sets they are providing for dentists. And this diploma exam, just think of it as an open access exam. It doesn't require training. It doesn't require a lot of paperwork. It just requires from you to be a dentist, good standing, practicing, and want to get more knowledge or want to get this title from the Royal College. So everything is good, but you want to reach out to these UK exams. Before, they had this another diploma exam in pediatric dentistry for dental therapists, so they can prove themselves. But now they have a separate diploma exam for dentists as well. And an example of this diploma exam, other than pediatric dentistry, which was really famous, that they have a diploma for special care dentistry, which is really famous from the Royal Colleges, about medically compromised patients plus 18 years old. Because in pediatric dentistry, you are dealing with medically compromised patients. But plus 18 in adults, they have this nice special care dentistry diploma, in which it's an appealing exam and a lot of people are registering for as well. So about the diploma, it's the level and the curriculum of this diploma is based on the skills required to provide tier 2 complexity of care as defined by NHS England. So about the UK, like what kind of recognition of this diploma exam in the UK? It's based on being a level 2 practitioner. So what's a level 2 practitioner? You are not a GP and you're not a specialist. You are practicing in between. Like what they call a general dentist with special interest in pediatric dentistry. So he will submit this diploma, submit some cases to the England NHS. They will analyze his application and they will approve them as level 2 practitioner. Okay, so that's what, like, why they do this? Why they do the exam? Because in UK they want this. They don't have many specialists, and they want more people who can treat children. So they make these diploma exams, and now they want also like getting more international candidates to do this diploma exam. It's held in the UK in Edinburgh, and surprisingly, I was browsing through the exam calendar, and it's open. Like the applications are open now. It's next May. We are now in September, so we have 4 months and another 4 months. So you have like 8 months until the next exam, but it's open. It's open for registration. It's held in the UK. It's available for pediatric dentistry, endodontics, orthodontics, periodontics, and as we said, special care dentistry. But the only one that I have seen while browsing the exam calendar is pediatric dentistry. What's advantageous of it? It's easier. It's only MCQ and 8 unseen cases, no OSCE, which is a lot easier. And it doesn't give you a specialist degree. It's only for knowledge and recognition, like you are in good standing. You are practicing in your country, pediatric dentistry, and you just want this one more certificate to prove yourself. Or you have your master's degree and you are already a specialist, but you want this one degree so you can upgrade your knowledge with the UK system and have the certificate. Or you are studying ORE and you are going to the UK, but you didn't do master's degree and you don't want to invest in 3 years of commitment of training, but you are interested in pediatric dentistry and you want to go there as level 2 practitioner. So this diploma exam will be suitable for you. Okay, so these are like the 3 situations that I can think of. It's also, as we said, suitable for as long as you are in a good position regarding your degree current now and your current practice, and you can commit to a long-term training. It's about self-education, of course, with some help about the UK system. What about the accreditation? It's not required as specialist qualification, but it signifies your interest and your commitment, and it's backed only by the reputation of the Royal College. Like now you have a certificate from the Royal College, you are diploma of pediatric dentistry from Royal College of Surgeons of Edinburgh, like you can include this in your title. So you gain the knowledge and you get the certificate, but you know that you are in a good position, like you don't want commitment to long-term training, and you already know that you are good with your current practice and you just want to upgrade your knowledge, but not the international recognition or gaining specialist degree, because this diploma is not specialist degree. What are the prerequisites and requirements? It's open access, no formal training, but they suggest that you have some training or some guidance around 2 years in your chosen subject. Also, you need to have your primary qualification, your BDS degree, your primary qualification in dentistry 3 years before applying to the exam. So we are saying the next exam will be on May 2026. So you need to have finished your college on 2023. So you can apply on 2026. Of course, your internship year can be counted as an experience year. So experience year internship, and a couple of years afterwards, you can go ahead and enter these diploma exams. Also, you should be currently practicing. Like you will get the course, you will have the points. You need to apply it in real life. Like you will have this training, and we'll tell you in the UK they want you to do that and do that. So it's really better if you are practicing, so you can get that and apply to your practice, because they test that in their Viva. In the Viva, they will tell you, so you get this case, how you manage it in your clinic, how you manage this case in your clinic. So they want to see how are you applying the knowledge to the real life, not only saying what knowledge you have. They want the application in real life. What's the best practice? Take the course. It will be also online sessions. Apply it in real life, book the exam, and get the UK visa as well. We have one question here. What certificates you will take after the exam? You will get diploma in pediatric dentistry from the Royal College of Surgeons of Edinburgh. Like we know here in Egypt, we used to have diploma training, like 1 year training, and afterwards you get diploma from a university. It's the same, but with no formal training. You will go there, you will sit for the exam, and you will get diploma in pediatric dentistry from Royal College of Surgeons of Edinburgh. That's the documents you will have in your hand afterwards. This is the link for the exam, and we can also paste it in the WhatsApp group. So the cost for this exam is less than the membership. It's only £1,235. And also afterwards, when they do the certificate, and afterwards you may pay 100 or 200 for giving you the certificate with your diploma. There is also visa fees and travel fees, the same, but more towards the $3,500. And also the cost of the course will be the same, but it will be about not the same curriculum as the MP did exam, because you have different blueprints. It will be a different batch with different curriculum, which is directed to this level, so you can apply it. And we had contact, so we have been training people for a couple of years now. We had different batches and membership exams. And the only international candidate who was in the last diet, there was 5 from the UK and 1 from outside who was applying for this diploma exam. And we had close contact with them with the materials and the training. So we also have an idea about what they are looking for in this diploma exams as well. How to register. The days of the exam, sometimes they are 4 days, but you will do one ONSI, one MCQ, and then only 2 days of Viva, and that's it. Like sometimes there will be like one post day in the middle, and then you continue your exam. But the number of days are only 3. Like the number of days of exam, only 3 days. but sometimes they will tell you the exam is from 6 to 10. So there'll be 4 days, but one day in the middle will be off. So the actual exam days is not 4. Like the membership, it's only 3 days. And the same registration procedure as well. So these are the 2 different exams that the Royal College is currently giving or providing in pediatric dentistry, and it depends on your current situation if you want to apply for the current training on any of these. So with this completed, now anyone, if you are having any question, I know that we are having people from Middle East and people from India, Qatar, Oman, and different. So we might start to receive question, and you can ask the question in the language you want. You can speak in English or in Arabic. It will not matter, because now we have completed the webinar, so you can ask in English or Arabic. I'll be happy to answer your question as well. So if anyone having any question, please let me know. Okay, so Dr. Iham, please go ahead. You can unmute your mic.
Hello, everyone. Thank you, Dr. Ahmed, for this nice lecture. Thank you for instructions and the amount of time you invested in this webinar. Thank you so much. At first. Secondly, I'm a candidate of pediatric dentistry master degree in one of the Egypt known universities. So I want to know if these will qualify me, or the training program of the master degree is considered a qualification for the membership certificate. I'm currently a master degree candidate in Entrance University. So I would like to know if this program training is considered a qualification.
Well, this is a really good question, which we have answered earlier. The problem with Egyptian master's degree, one, they are not full-time. Do you go to the clinic each and every day to the clinic? No, I don't say the university or the lectures, but do you go inside the pediatric dentistry clinic in Ain Shams University each and every day, or 5 days a week?
No, it's 2-3 days per week.
Yes, maximum. And also from what we know, that the curriculum is based on mostly on the US curriculums, the materials you study from, and is it more of US based or UK based, or it's a mix from the both guidelines?
It's a mix of both guidelines. We depend mostly on the American Academy of Pediatric Dentistry guidelines, but also sometimes we use the European guidelines as a base for some topics.
So this is the thing, that it's not full-time, it's not 60% clinical. The curriculum is a little bit far from what they provide from the UK. That's why all people who have master's degree from Egypt who have sent their applications, they got rejected. Unfortunately, they got rejected. What, of course, you are eligible for is the other one, the other exam. But for the membership, no, it's not qualification. So what you can do, it's either you get another 3 years full training which is acceptable to the Royal Colleges, or you go ahead for this diploma exam. These are the 2 options.
Thank you so much.
Okay, we have another question. Tripilat Dental.
Hello.
Hello.
Thank you so much for the webinar, sir. So I'm practicing in Nepal currently.
In Nepal,
and I've done my master's. Yes, and I've done my master's in India. Okay. So I understand it was a full-time course, so I should be eligible for the MPEDs. What I wanted to understand was how it works in the sitting, as you mentioned, because there are 4 parts of the examination.
Yes.
And since you mentioned that the MPEDs examination might not continue September 2026 onwards, just in case we are not able to clear like one of the settings, how will it work?
This is really good. So if you got accepted and your application got accepted, and then you went to April exam and you didn't succeed maybe in one part, right? So you have two trials, another two trials in September and in April 2027 to clear this. And one good thing about MPEDs that when you fail one thing, you don't get like the whole exam again. You just go there and get tested for only the part that you didn't pass. So you still have two trials, so you can complete your exam as well. What will happen from September is that from September 2026, it will be a fellowship exam, in which they want MFDS from you, they want IELTS of 4.7, and some different prerequisites, and also the format of the exam might be changed. So these are like the two differences. The exam is not being stopped, but it's being converted from a membership to a fellowship. And you still have two trials to complete your exam as well. I hope this answers you.
Yeah, thank you so much.
Okay, now we have one raised hand. Dr. Mahmoud. If you can unmute your mic. You need to unmute your mic first. Okay. Okay, so if you want, please raise your hand again and unmute your mic so we can hear your question. I can find some questions are in the chat. What sources for preparing for the MPED and diploma as well? So the sources that you will get in the course, it's a summary of all the papers, all the guidelines, all the UK guidelines, most of the books that are related to the subject. So you are getting like handmade postgraduate notes, okay? And these are the best. These are the best material. So I hope this answers your question. You will get also previous MCQ bank, and you will get also previous questions in the course. We have another question on the chat from Ala.
مرحبا. Hello.
Hello.
Can I ask in Arabic?
Yes, you can.
Yes. أنا من الأردن. هلا في عندي استفسار صغير. هلا أنا board certified pediatric specialist. بس أنا التريننج عندنا في الأردن بنقسم لاسمين، في تريننج باليونيفرسيتيز وفي تريننج في انستيتيوت اسمها الرويال ميديكال سيرفيسز، هاي تابعة للجوردانيان Armed Forces. فهلا أنا اتدربت فيها، بس هاي it's a full time 3 years training residency، وبعديها بكون eligible إني أدخل على البورد، وهي الانستيتيوت الوحيد اللي بقدر إني أنا أكون فيها eligible إني أدخل على البورد إكزام. بس المشكلة فيها ما فيها ماستر بروجرام، يعني أنا without master degree. هلا أنا recently أنا كنت في الUK وعملت ماسترز بكينغز كوليج لندن بالريجنراتيف دنتستري فهلا السؤالي الآن هلا أنا لأنه أنا ما معي ماستر بالبيدياتريك دنتستري ومعي ماستر بريجنراتيف دنتستري ماستر اوف ساينس، بقدر أكون أنا eligible بالبيبر لو بدي أقدم لهذا الإكزام ولا لأ؟
ده سؤال كويس جدا. الفكرة إن هو أنت your full time training in Jordan, okay? And
Yes.
you have your board certificate, right? Oh, they don't require like you shouldn't have master's degree. No, they want 3 years full time training. Your training was 60%. Like can بتروحي كل يوم على الكلينيك?
Yes. كل
Okay.
يوم أنا إلى الآن I'm practicing عندهم بالهاي الانستيتيوت، بس now I'm practicing as a specialist عندهم.
Did you have any small part of research like case studies, anything
إيه،
like to just give in your exams? Just
هلا
small research.
يس عندي papers اشتغلت عليها بعد ما أخذت أنا البورد. يعني هلا في منهم انتشر وفي منهم I'm working عليها، مثلا case report وأشياء مثل هيك.
مش لازم publications بس كنتوا بتنفذوا حاجات أثناء التريننج.
يعني مثل إيش مثلا؟ يعني إني أنا
like publishing case studies, or did you publish some case studies from your training like
لا لا
شغالين عليها أثناء التريننج؟
لا أثناء التريننج لا.
طيب هل في اي جزء كان له علاقه بالكواليتي كنترول؟ كنتوا بتعملوا كواليتي كنترول على بعض الحاجات في العياده او things like that؟
يس
كان في كواليتي كنترول بروجكتس؟
يس كان في quality control projects. يس هلا هاي
very
ممكن أستفيد.
ممكن تعتبري ان كواليتي كنترول بروجكتس دي that was your research like انت كنت مثلا بتقيسي حاجه مش شغاله كويس في العياده، بعدين تعملها improvement، بعدين تعملي another cycle.
ممكن تعطيني مثال على مثلا مثلا مثل إيش مثلا؟
يعني مثلا they are not giving prevention instructions for high-risk children, and then you educate your colleagues on giving prevention instructions and putting like signs and discussing with them, and then measuring the percentage of children who are getting prevention instructions after some time, and then you find an increase. يعني بتحسني وضع الشغل نفسه.
يس عملت هيك عملت هيك إشي على يس على مثلا على موضوع مثلا التيثينج مع الأهل، والموضوع التيثينج مع البيرنتس ومع الأشياء وعملت زي سمول ستدي مثلا على إنه الأويرنس تاع الأهل مثلا على موضوع التيثينج وشو الساينس حكى وشو هم. فعملت مثل هاي، هل تعتبر هاي مثلا كواليتي كنترول
أثناء التريننج؟
أثناء التريننج.
Okay, so this can be considered as research. So mainly they want clinical training 60% or more. The other parts يعني كان عندكم بعض الليكتشرز عن منهج
يس شور
هل منهج البورد يو كي بيزد معتمد بصوره كبيره على اليو كي سيستم، ولا برضو على امريكان اكاديمي اكتر، ولا ميكس ولا؟
هلا هو صراحة على الأمريكان أكاديمي، يعني حتى الريسورسز اللي إحنا كنا نرجع لها كانت على الأمريكان أكاديمي. بس هم بس يعني كان في زي مثلا الجامعات عنا مع الرويال ميديكال سيرفيس اللي أنا تدربت فيها، إنه كلياتنا لازم نكون ماشيين على مبدأ واحد في الكوريكولم تاعتنا في البيدياتريك دنتستري تريننج.
دي الجزء ده هتحتاجي بس تبصي على الرويال كوليدج
requirements
and also the curriculum. You need to match the curriculum, but rough matching, يعني not very detailed matching, only rough matching. And you can submit your papers and your application. But the thing that يعني هيبقى فيه تقديم كتير. هل أنت معاكي مثلا غير الحاجات دي MFDS أو حاجة ليها علاقة؟
Yes معي MFD.
Very good. So حتى لو ما فيش فرصة في April, you can still apply in other يعني other follow-up exam. So from what you are saying, you have a good chance. Okay, especially that you have already the MFDs, the MFD 2 parts. So what you should do is to compile the papers and like get your chance with the board, so they can see your papers and be familiar with the process. So you yes, still have a chance, especially that you are also having the MFD. So if you miss April, then you still have the chance in other diets as well.
In other اوكي تمام شكرا. بس ممكن بس سؤال صغير. هلا حكيت انه هاي الريجوليشنز رح تتغير في سبتمبر 2026، انه كيف رح تكون التغيرات؟ يعني رح تصير شيء يعني رح يكون فرق، يعني غير فرق.
From membership it will be fellowship. هتبقى fellowship exam مش membership. And MFDS will be required, and IELTS score 7 or something around that. يعني حاجة مشابهة للIELTS score 7 will be required as well.
اوكي تمام. شكرا.
توفيق. Okay, so going back to our questions in the chat. Okay. Okay, so yeah, Dr. Aya, when exactly starting the comprehensive course and about the price. The comprehensive course for MP Dent will start on mid-October, 14th of October, 2025, and the price for it is 1,300 US dollars. 1,300 US dollars. Dr. Tiliptilaf, how many hours in a day we are expected to spend on the training until exam? So it's better to catch like each and every day about 2 hours. And when you are getting closer to the exam, you want to increase this gradually. Like 1 or 2 months, you want to spend more than 2 hours. Dr. Ayas, if I take MPED on April, I have 4 trying or just 3. What they say that this time, because it's the last diet, you have April, September, and April, only 3, not 4. So that's, I think, how it goes on that part. They say that you only have 3 trials. Okay, Dr. Ayaz asking, can I get a fellowship if I have the MFDS and take the April exam? Anyone who is taking April exam, even if it's membership, the Royal College will ask you, do you want a membership or a fellowship? Then you will tell fellowship, they will ask you to pay a little bit extra fees and you will automatically become a fellow without any other papers. So even if you go to April exam, you will still be a fellow, like all of us. We have entered the exam 2 years ago, and it's converted from membership to a fellowship. Some doctor is asking about the requirements. You need to apply for the MP Dent. For the MP Dent exam, you need to have 3 years full-time training. You need to have 60% clinical or more. You need to have a curriculum that's similar to the UK curriculum. You need to have clinical evaluations that are accepted to the UK. And also some other paperwork as well. Dr. Roa is asking, what about the MFD exam? I have Irish qualification from Ireland. This is a good question because let me search about the document here. If I can find this document about the updates and the transitional part. They said about some transitional regulations that they will be applying, and they were okay. Okay, so I will show you this in the presentation now. DFSE. Okay, so let's cancel and try to present again. Okay. Close and reopen again. Okay. Let's close the sticky notes. And let's open this one. It's not showing, but let me read it for you. It says in the transitional requirements or transitional consideration, which were published on 17th of July, 2025, that Royal College of Surgeons of Ireland, MFD, if you mean that, Royal College of Surgeons of Ireland, MFD, will be considered an acceptable alternative to MFDS until May 2027, at which point, the new tricollegiate MFDS examination arrangement will take effect, and the equivalence to MFDS will be reviewed. So from what they say, that Royal College of Surgeons of Ireland MFD will be accepted until May 2027. And the MGDF will be also considered acceptable alternative to MFDS. So if you have this, they say that you are eligible, but still you want to check that with the college itself when you get the email confirming that, and also read these transitional documents which are available on the website. You will have the sense of security in you. Another question: which has better international recognition, membership or fellowship? They are the same. If you get membership, you will become a fellow. If you go to fellowship in September, you will be a fellow. So it's the same. What is the difference between MPED and fellowship? Nothing. Does it have recognition in Gulf area? Yes. Saudi Arabia have recognition. United Arab Emirates have recognition. Sultanate Oman have recognition for the MPED and FPED, and it's the same for both of them, because now they want to convert all the membership to a fellowship exam. So this is the answer for all the questions which have been asked here on the chat as well. Okay, we have one more question here from Dr. Shahid, who did his post-graduation in India in 2015. Do I need MFDS qualification to appear for MPEDs? If you are applying next April, you still don't need MFDS. But if you didn't get the chance to enter in April and you are entering in September or later on, you will need the MFDS to apply later on. So I hope this answers your question as well. Okay, with that wrapped up, let us see. Okay, there is no other question so far. Okay, another question. Okay, doctor, go ahead.
So I just wanted to know if we appear for the exam, like you mentioned, it's in 4 parts. Are they like back to back? Are they all together, or they like happen in different sections or at different
days? Day 1 will be MCQ,
Okay.
90 questions, then rest, then 90 questions. Okay. Second day, OSCE stations, 6 stations, all in one go. Okay. Third day, 4 Viva cases. Fourth day, 4 Viva cases.
Thank you. I think because someone told me that we can appear for like a certain section of the exam in the Gulf countries, like few other countries are also like
Only UK,
they conduct
only
the exams.
Edinburgh. Until now, it's only Edinburgh for all the pediatric dentistry exams. I think the thing is that there is not a lot of examiners, because in this exam, the only top level examiners, and they only appear in Edinburgh 2 times a year, and that's it.
Thank you.
Okay, I hope this has been useful for all of you. I'll be pasting the link for, okay, Dr. Ra, go ahead. You need to maybe send an email to the Saudi board and ask them about that. But from what I know, that last years, the MP Dent will only give you residents, only residents. Now it gives you a registrar, and a couple of years after, you are becoming a senior registrar. So that's what I know from my connections. But to get like the most accurate and the most confirmed answer, you might want to message the Saudi board in that, because now we know a lot of MORTH candidates in Saudi, they are getting senior registrar. They are all converting from a registrar to a senior registrar after a couple of years of experience in Saudi, not in or in any other country, not in UK. So, but if you are on the GDC list in the UK, you are a senior registrar just the day after you finish your training. You don't have to have any experience. if you are on the GDC list in the UK. So this is a whole different classification as well. So what I know that there was an upgrade for MPEDs, even for people who are trained outside Saudi, outside the UK. There is an upgrade. And it was tested repeatedly from candidates with M-Ortho, okay? And yeah, but there is also the pathway of the UK trained dentists, which have a different classification because they consider them as like Class A countries, or they have different evaluation. One question: how many times a year does the exam of diploma of pediatric dentistry happen? Only once a year. Like last year, it was in May, and 2026, it will be in May as well. Okay, Dr. Aya is asking, having Egyptian master certificate, what are additional requirements to apply for the exam? Dr. Aya, are you asking for membership or fellowship, or are you asking for diploma exam? So it's all different, if you can tell us. Okay, then we have okay, Dr. Shahid is asking, can I apply for April exam now, or it's already closed? It's not open yet. It will open maybe in the 1st of November. But you need to get like work on your paperwork and get it finished and done and being sent for the board, which will have time until reply. So it's not still open on the website, but the paperwork process takes time. So like you need to be familiar with this part as well. And Dr. Nahid is asking, in Oman, people who had MRD, they didn't accept it to make these dentists to do the exam for specialty. They told it's not privilege unless training in the UK. For Sultanate of Oman, we have this document which says that if you have this and some current years of training or years of experience afterwards, they can put you on specialist list. But we know that in Oman, the specialty board for examination is not frequent. Like they will not gather a specialty board for you to test your qualification and give you a specialist. It doesn't have very often in Oman. But for these country-specific questions, because what I have is only the document, and the document says if you have FP Dent, F Ortho, MP Dent, M Ortho, and have these current years of training, then you can be a specialist. And it doesn't mention that training has been done in UK or not. So for this part, you need to email the board of the country, the health board of the country, and ask these specific questions as well. Dr. Aya saying having a fellowship allows you to be in academic field in the UK. Not necessarily, because it's whole different. If you want to be academic, you submit for universities, you see your acceptance, you see the fees that they want from you. If you want to be clinical, you will have fellowship plus the ORE. You definitely want to have the ORE before practicing clinically in the UK. If you want to be an academic, it's whole different. It depends on research, on the spots available, on the price of them. It's not like having a fellowship can prove that you know about the UK system, but it's not a prerequisite for anything academic over there. Okay, it might enhance your application, but it's not relevant. Okay, having a fellowship. Okay, Dr. Shahid is asking your course brochure link and process, and if I want to know about it in detail. This webinar will be recorded. We were discussing about different parts of the course, so it will be recorded and uploaded on a YouTube channel, and then we will give a link for this, so you can be familiar with it and also get to the other part in detail. And then you can send your questions to the number of the course coordinator, which we have also in the WhatsApp group. Okay, another question. Do they have any acceptance in Australia? The MP Dent and the FP Dent. I don't have an idea about that. You can also search about this and send an email to the health boards over there as well. Okay, again, there is a question from Dr. Ra'a. Go ahead, please. Okay, I think this was already asked before. Okay, any other questions before we finalize? Thank you all. Have a good day. And I will paste the link of the group here if anyone is not on the WhatsApp group, so they can join. In the chat, you'll find a chat on the right corner, the lower right corner of your screen, so you can join the WhatsApp group if you are not there already. And I'll be pasting the links for registration for the course and for the exams that have already opened, so you can also have an idea about it. Have a good day. It's been wonderful to speak to all of you, and good luck in all your career and all your future steps. Thank you. Have a good day.